Hi everyone, my name's Sarah and I'm going to be talking to you guys about the impacts and implications of COVID-19 on healthcare workers. I conducted a review of 10 primary research articles and they revealed three common themes: risk assessment, physical and psychological impacts, and how we can best support staff. Now, due to the novelty of the COVID-19 infection, the healthcare system was initially unprepared, and this made healthcare workers a common and easy target for infection. Other major factors for infection among healthcare workers include lack of understanding of the disease, inadequate use and availability of personal protective equipment, uncertain diagnostic criteria, unavailability of diagnostic tests, and psychological and physical stresses. As for the impacts of COVID-19, it has become evident that healthcare workers responding to this pandemic outbreak exhibit a number of negative psychological and even physical consequences. Examples of these include decreased physical activity, unhealthy eating, depression, anxiety, and insomnia. Now, we're at the point where we can discuss how we can best support healthcare workers. This involves offering solutions and resources that will allow them to better perform their duties and during this stressful time. Examples include education and training, reduce the chance of infections, shorter shifts, counseling opportunities, physical health support. In order to counteract the negative consequences these workers are facing, employers and others are working tirelessly to develop long-term strategies. However, in order for us to help them, healthcare workers need to be helping themselves. COVID-19 is not going away anytime soon, so they should be preparing themselves by implementing these types of strategies into their daily lives. Examples of what I'm doing as a new healthcare worker include planning ahead of time with healthy meals and snacks for my shifts, and scheduling time to exercise when I'm not working. In addition, healthcare workers should plan to make more time for themselves and get plenty of rest when they can. As we continue to deal with this pandemic, it is critical we continue to research this topic. It is also important to specifically analyze the data from summer of 2020. This was the world's peak of cases and deaths so far. Based on my research, I know how important it is to be aware of what is being done to protect healthcare workers as they prepare not only for this next wave, but for future pandemics. Until we mitigate the spread or there is a vaccine available for all citizens, the brunt of the pandemic will be felt by all these frontline workers.